him back on, and especially if we can bend this a little bit to the arena of oral health. So there's a couple of housekeeping things here we probably want to get out of the way first, and that is the disclaimer, and that is we do represent ASEA, as everybody on this webcast would already know, but we make no claims to treat or diagnose these molecules, as fantastic as they are not used in that fashion. They are a supplement, and so we don't present them that way. We don't pretend that in any official way. We will talk about the redox biology that underpins this fantastic product, and hopefully you can connect the dots and make some of those connections in your own life. We do have the chat box open, at least as I am seeing it. And so if you do have questions tonight as we go along, understanding that we probably can't address specific, medical or dental situations, but please feel free to enter your questions in the chat box, and we'll try to tend to that and respond to those. As Maureen said earlier, let us know where you're coming in from, and we'll go from there. So tonight, I think I'd like to start with Dr. Bill. He's out there sitting on the beach in a real casual manner as usual, but he's a serious-minded dental player. Maybe you could give our listening audience just an understanding of who you are and kind of where you came from, how you came to know about ASEA, and why this is even something that registers with you.
Thank you, Lee. Good to be on the ASEA 5 again. And for you guys out there, I've been a dentist for 45 years in practice, still practicing. Turned 71 this last month, and I've been involved with ASEA for 2.5 years. And I take this every day. It's one of our essential nutrients, I call it. And I'm always getting people ask me, why do I look so young? And it's because I use the Renew 28 twice a day at least. And my belief in it is very high. So I put it into use in my family first and practice second. I used to teach a lot in technical dentistry, TMJ, orthodontics, reconstruction, and that was great for 10 years. And then I got into marketing and management for about 20 years like that. And so I've kind of gone back and forth teaching different parts of dentistry. And Lee Osler, my buddy here on the left, actually introduced me to it, just talking about his personal story with his wife. And I was so intrigued, I went ahead and joined ASEA right then and started using it immediately. And I saw some changes over a period of time. My wife saw changes, my family saw changes. So we had what I call the average result. Nothing major, everything great, but we were healthy already. And I guess we'll go into those things later, but I've been a dental educator, and I enjoy educating people on ASEA because it's a good product.
Yeah, thanks. I'm glad that you shared that story with us. I'd like to kick it over to Grant. Grant, I don't know that I've heard your story. Everybody's got a story about what attracted them to ASEA. Could you take a minute and give us your background and what what's the ASEA story that you have in your back pocket?
Certainly. I graduated, 1997 from Oregon Health Sciences University with a Doctor of Dental Medicine, similar to Bill. And so I've been a dentist for 24 years, did a residency 1 year at the VA Medical Center, and just practicing dentistry. And a few years back, I started looking for more healthy ways to keep my body young, to try and fight the aging process. And there's some good products, but the way that ASEA came into my life was that my father in the cold winter months, he had he slipped on what we call black ice up here in the Northwest. It's real thin ice that can't see, and he came down. He was 91 years old, and he came down full force on his skull, and it ended up with 3 brain bleeds. And had it not been for a sister going through town, he probably would have died that night, bleeding out from his skull, because he went back up to take a nap. And anyway, so it was right at that time that my sister had learned about ASEA. She was down in Portland, Oregon, and she told me when I was at the hospital with my dad, "You've got to get this stuff to Dad." And she'd heard stories I had not, so I was very skeptical. Bring something into the hospital, give it to my dad, and violate my ability to see him. As a dad, I had a continuing education seminar down in Portland, Oregon the following weekend, and we went down there, and she actually had a presentation go on, and Dr. Dick Walker was our 3-way call that joined us afterwards. And I was introduced that way. I got a chance to meet Dr. Walker on our way back from Portland. He showed me the science, which helped eliminate pretty much most of my skepticism, seeing his background as a medical doctor, emergency room doc. And so we started getting these molecules to my dad, and he went through a major brain surgery, and then he had to go through physical speech occupational therapy, and we were able to get the product to him, get the redox molecules to him, and he was able to recover at our pace. The therapist had never seen anybody recover as quickly as they had seen him recover at his age. And the usual outcome of a fall like that a lot of times is fatality. And there were a number of fatalities that year with younger people. And so that was the main thing. We saw a huge recovery, and then simultaneously, my sister was staying with my mom, and she started giving molecules. My mom has one of those situations where you start losing your memory at a elderly age, and they started seeing results. People that were around her saw results within the week. They couldn't understand what was happening to her. Now it's 7 years post that time, and my mom is full of vim and vigor, for lack of better terms, and she is not the woman that she was 7 years ago. My dad is not the same person he was 7 years ago. Most people where they live think that his dad's about 20 years younger than what he is. He'll be 99 this year, and my mom will be 98 in another month. She's outlived her all of her relatives. And that same year, I ended up having a cat bite, severe cat bite. Ended up in the hospital and surgery. And so I used the molecules. I sprayed them on my hands. I used the gel, and my recovery. I also had the molecules in the hospital. Really didn't have problems with pain issues, but after the surgery and the hospitalization, I had to go through hand physical therapy, and the therapist and the hand surgeon could not believe that I was able to recover that quickly without discomfort. And I've got more, but I don't know how much you want to know.
So a lot of your experiences there in the early going was with other people.
Correct.
Yeah, a lot of people kind of come in and they think, well, they need to have their own personal thing, but it's very, very beneficial when there's somebody else in their circle or their family that has that. That certainly was mine, my experience. My wife's physician told us that we needed to get her on some redox signaling molecules. I asked him what that was, and he said, just go Google it and find some. And I thought that was kind of strange. I didn't really understand, how it was supplied. I had some ideas, but you know, I thought, all right, I trusted him enough that I just went and did it. And when we actually received it a few days later, it was amazing. It was, I tell everybody, it was like flipping a switch. She just, probably inside of 48 hours, it was like she came to life after, you know, suffering 30 years with just a lot of ongoing stuff. And, you know, I'm not going to sit here and pretend that she's 100% better, but I tell you what, it's made a tremendous difference in her life and my life. And so it wasn't my personal experience that, you know, turned my head and dropped my jaw at this. It was that really, you know, taught me what was going on. And then I dug into the science. And so, so that's kind of where I came from. My background is I'm a past president of the American Academy for Oral Systemic Health. And so I've spent a lot of years in an area where we didn't have really definitive science. It was all kind of circumspectual and not necessarily hit and miss, but it wasn't causative. You know, we can't say that, for example, gum disease causes Alzheimer's or heart disease, but there's thousands and thousands of articles that talk about the connection. And I saw what an interesting maybe coincidence or a parallel, because as I started to dig into what redox biology was, what ASEA was, again, there's nothing in this that we can point to in terms of scientific literature that brings us to the level of causation or even, or as I said earlier, even treatment or therapy for. It'd be kind of nice. It just doesn't live in that arena. But there's tens and tens of thousands of articles that talk about redox biology, that talk about the physiology of redox signaling in a myriad of different, you know, applications. And as you start to connect the dots and pull it together, then as you look at people's experiences, you start to realize, you know, what it is that's really going on, and you can make your own conclusions. So with that, let's make a pivot towards dentistry. I know there's a lot of people who have engaged all of us, you know, over the last many months with questions about their, you know, dental conditions and dental health things. I think what I'd like to do is maybe throw it back to you, Grant. You can respond first, and then let's go to Bill. Let's talk about the oral systemic connection. And, you know, if you want to throw some redox related, you know, science in there, if you will, that's fine too. But let's just kind of establish what is the oral systemic connection, since that's our theme tonight. It's a dentist theme, but I really rather characterize it as oral health than just tooth health. Grant, go ahead and give us your thoughts there.
Sure. Well, we know from studies that were done before this technology was established by the founders that it does have effects on the microbiology, the microbiome of various parts of the body. The mouth is no different. So I don't, from personal experience, have any reports on the reduction of the oral cavity load of bacteria, but I have heard many people that have had that. I sold my practice prior to being involved with ASEA, and I've done work as a contractor and then as a public employee. So I've had some restriction on that, on my ability to use it in those settings. However, in some of the contracting settings that I did a lot of oral surgery, a lot of extractions, and some other soft tissue surgeries. And I started, because of my own experience that I had from my hand surgery and how quickly I recovered, the following month after I was able to get back to work, I started to use the redox molecules on some cotton after I'd extract a tooth. And what I found was that the bleeding would almost immediately stop. I usually gave it about a minute, and generally the tissue looked great. Sometimes the tissue was very inflamed and red and angry looking prior to the extraction, just because of the condition of the person's mouth. And what that told me, when we see that, we know that there's a lack of oxygen in the area. We know that the tissues are more fragile, they bleed more easily. And so it was really interesting to see after the extractions that the bleeding, the fragility, the bleeding would stop, and the color of the tissue, for the most part, always went back to a light pink color, which is generally a more healthy color in the mouth. And so those are the main things that I saw. The other thing that I saw too was it seemed like an accelerated recovery of the extraction site, an accelerated wound recovery. And what I would say is the redox molecules are they're signaling molecules. And so they signal for the processes of restoration to occur, including that healing process. And so basically, when we had a fresh wound or an extraction site, we had an area of the body that was ready to respond in some way. And we supplied the molecules directly onto the tissue and were able to start that process without any delay. And that's what I found also, is just the sooner that the molecules are applied to the tissues, that the more quickly the wound seems to recover.
What's interesting is that we've seen and heard many people's experiences, in all kinds of medical situations, injuries, even in pet health, wounds and pets and so forth. The very same descriptions that you're describing. Bill, do you want to chip in?
My experience is pretty parallel. Using the molecules in the clinical practice, getting people to take the liquid is number one. Just having them started before treatment and work their way through all the surgical healing time still on the redox liquid. That's kind of my number one thing to try to do, is to get people to ramp up, because we know it takes 28 days to get a good solid amount of redox into the system as it rejuvenates those mitochondria and works through those systems and the pathways. So when they get there, what we found is they, like you said, Grant, the bleeding is very slow. It doesn't pour out like we see in some cases when we do surgery. It just slows down quickly. So the clotting mechanism is enhanced somehow. And then I have patients say it's more comfortable. They have much more ease of treatment post-op. And then what I like is the results are better. One really good example that I see was when my sister-in-law took out 10 teeth and put in 4 or 5 implants and built a immediate bridge on top of it. So there was kind of an all-on 6 or all-on 5 type of a treatment. And so she came home to stay at our house that night instead of going back to her house, because she's disabled and we want to keep an eye on her. And she laid on the couch when she got home and never complained. And that's not normal for somebody who's had that much work done. She didn't complain, and she woke up the next morning and she didn't feel any pain. And that was 6 teeth, 5 implants and 10 teeth out. So I was pretty impressed that my sister-in-law, who normally complains about a number of things, didn't complain anything about what I did to her in the dental office. So family, you hope they get the best treatment, and this time they did.
Okay, those are some good experiences there. And again, we emphasize, the ASEA redox liquid or gel is not used in treating. Dentists often come to me and say, well, can I use this instead of whatever? And it's like, my answer is no, don't do that. This is an adjunct. We use this adjunctively, which means in addition to, and because it's so safe and non-toxic and it's over the counter and so forth, individuals can also, employ some of their good judgment at home. But I would always admonish you who are watching and listening, or who may watch the recording of this, don't get too cowboyish in your own participation of this, and make sure that you're following the directions and the instructions of your treating people. Well, let's talk about oral health for just a minute. There's some principles with oral health that matter. And I think they're a cousin, at least, to this whole redox biology thing. And that is the condition of the mouth, the health of the mouth, the bacterial load in the mouth, the size of the mouth, the size of the airway, the position of the teeth or the bite. All of those have very interesting and tight connections with the general health of the rest of the body. Grant made a comment about how the digestive tract, it starts in the mouth, it ends at the rectum, and in between there, we're loaded with bacteria. And certainly in oral health settings and situations, the bacterial load in the mouth matters. There's good bacteria in the mouth and there's bad bacteria in the mouth, just as there is in the gut. They're different bacteria, but they kind of operate in the same concepts. If we give the mouth the right conditions, and if we are active in cleaning our teeth and our gums, then the good bacteria predominate. If we eat the wrong things and we have the wrong pH acidity in our mouth, we're going to favor the growth of the bad bacteria that then causes, the diseases that start this cascading effect. But more than that, or in addition to that, it's these bacteria that create the gum disease, the bleeding gums, that break down the barrier between where the bacteria live and the inside blood circulation. It breaks down that barrier, and then the bacteria and their toxic byproducts can get into the bloodstream and go throughout the body. And in a word, we talk about that as being inflammation. And so when we speak of inflammation as a physiological reality, this is the same inflammation that all chronic diseases participate in terms of their pathology. It doesn't matter whether it's neurodegenerative or musculoskeletal or joint or gastrointestinal or anything. It's all driven by this inflammatory burden that can be created in the mouth. ASEA happens to be pretty handy at taking care of bacteria, especially the bad bacteria. There's ways that our immune system knows how to mark or recognize the markings on bacteria and to affect a change in whether they live or die. And we believe that this is an application of that principle. So Grant, do you want to speak to that oral systemic link that is, when we use the word oral systemic, we're talking about the link between oral disease and systemic disease. So there's a lot of chronic general diseases that we would all go to the physician to have treated, but they meaning physicians don't really treat the oral environment, and dentists and hygienists don't treat the general body environment, but there has to be a bridge between the two. Do you want to speak to that for a moment? You're on mute.
Yeah, I can share my knowledge that I have there. Mainly, I'm standing next to a giant, and that's Lee Osler, the sort of the authority in this area. But when, just for instance, periodontal disease, if somebody has deep periodontal pockets, they have a lot of bacteria down in there, and they do know that periodontal bacteria do show up in the blood vessels. They've been found in our atherosclerotic plaques, the cholesterol plaques that can clog up the vessels, and they've been found out. So they've been implicated with to some extent for the heart disease issues. And so if you have something like redox, which is helping, it helps the body's own immune system to fight and recognize these things. And then you have the effect that some of the redox molecules seem to have on the bacteria themselves. And I can't explain why or how it would be able to differentiate between the good bacteria and the bad bacteria in the oral cavity, but apparently so. And we have heard anecdotal reports from people that have had reductions in those pockets, that they've had deep pockets for some time. They started using the Redox either in rinsing or brushing with it on the brush, and then going back and getting good reports, reversal of some of the numbers, reduction of some of the numbers in those pockets. You know, so as we go down through the system, as the redox molecules go down and get into the gut area, the intestinal area, we know from genetic studies, there was a study done by a group called Torrey Labs. They're out of Utah, and they are the lab that does the Ancestry.com testing. But the reason that lab was started was to study genetic defects before birth and to see if there was some way to correct those before they were expressed later on. So one of the things they found is that there's a tremendous effect on the digestive system with the redox molecules. And that also includes the enhancement of the improvement of the inflammatory response throughout the body, but also there. And I know, you know, we're not talking about any diseases or anything, but sometimes people, through foods or whatever, the cells that are holding the walls of the intestines tightly together become loose, and little food proteins can get out in those little gaps between those cells. They get into spaces where they're not supposed to be, and then the body naturally mounts some kind of an immune reaction, and then you get food allergies because of that. So one of the good things about the redox molecules is the redox molecules signal for repair of things that they see wrong, which those gaps would be something wrong. So if we can close those gaps, we can get a big jump, I think, on the body's response.
Bill, have you noticed in your career or studied much the effect of nutrition itself on oral disease, specifically, for example, periodontal disease? What would be your thoughts there?
Yeah, if you're missing out on some of the basics, yeah, your periodontal disease is going to be a lot more extensive. Of course, just, you know, the vitamins that you take, the minerals you take in, vitamin D, probably number one. And anything that leads to an upset of the apple cart for formation of glutathione. And one of the main things about periodontal disease is you have low glutathione in your system, which is the body's major antioxidant. So we have an ideal supplement in ASEA because it supports the formation of glutathione by hundreds of percent better if you have it versus not having it. And I think, you know, the basic nutritional components of food, natural foods, whole foods, number one. Processed foods don't have all the things we need, so we have to supplement in certain cases. And luckily we have those things available through the ASEA Via line. But I think nutrition and dentistry go hand in hand. Digestion, breaking down the foods in the mouth, starting with simple things like amylase, breaking down the starches, breaking down the things to simple sugars. The more you do, the better you get.
I'm glad you brought up the glutathione thing. As some of you know, I'm writing a book. Here's the cover for it.
Redox Matters.
Redox Matters. Connecting the dots between redox biology and health. Hopefully this will be out sometime mid-summer. There's another book for those that want to get into the hardcore science called Redox Life. I just checked on Amazon. I think for a cool $500, you can pick up this book now. And so, but it's chock full of the science. And I read the entire thing. I guess that goes with my character. But the glutathione thing is really important. We've got research out there that's showing that periodontal cells. Now, periodontal means for the the gum tissue that's around the tooth. And so these gum tissue cells that line the side of next to the tooth, these cells, these epithelial cells, are just like any other cell in the body. They have mitochondria, they have nucleus, they have metabolic pathways that they have to go through. And when they're under attack by noxious or pathogenic bacteria, they have a state called oxidation occur. They become hypoxic, meaning not very much oxygen. Obviously, the poisons and the toxins from the bacteria themselves begin to affect changes in those cells, and they become, as Grant said earlier, they become very fragile. And when that condition happens, it's like they become poisoned. Their metabolic pathways aren't working well. And just to back up for a moment, the reason why inflammation kicks in is because of a really important molecule called nuclear factor kappa beta. We call it NFKB. For probably 15 years that I've been really in the hunt and the fight with oral systemic disease, this NFKB pathway, this inflammatory pathway, has been nearly 100% our focus. We talk about the effect of endotoxins from these bad bacteria activating the cells, the nucleus of the cells, and it creates the inflammation in the form of cytokines. Anybody who's been following the news lately about this bad disease that's going around, we talk about the cytokine storm, or the overreaction of the immune system to whatever it is that's going on. And this is not that much different, except it's not a whole body overreaction, it's localized. But that NFKB inflammatory pathway activates, and it produces these pro-inflammatory proteins or cytokines that then cause more damage in the gum tissue. That's what gum disease is all about. And what the research has noticed is that in those cells that are affected like that, they all have lower levels of glutathione, and they have lower levels of what's called NRF2 activation. NRF2 is kind of the polar opposite of the NFKB. The NRF2 is the antioxidant gene transcription factor. That means that when NRF2 is activated, it tells the cell to make some antioxidants like glutathione, so that the glutathione can go back into the cell and restore the cell to perfect health, to rebalance that oxidative state. The one difference in that equation in the mouth is obviously the presence of foreign bacteria. Just because I drink ASEA Redox, swish with it, or brush my teeth with it, or swallow it and get it into my bloodstream, doesn't mean that the bacteria are just going to stop walking in through the door. They're always there. It's like the mouth is an incubator. And that's why you have to brush your teeth every day and floss your teeth or use a water pick, is because there's that constant source of new bacteria that you have to deal with. And so what I've found, and the way I characterize this is kind of a dual edge, a dual function. I have to deal with the bacteria, but I also have to do something that enhances the cell's ability to defend itself and to repair. And those cells that have more glutathione, that have more NRF2 activation and less inflammatory activation, those heal. Now, that's chronic disease. The things that Grant and Bill were talking about earlier were when we did acute things. There was a procedure performed. It was this day, this moment, rather than something that was lingering on for 12 months or 12 years. And so the principles are still the same. And that goes back to I think the brilliance of connecting the dots is if you understand that ground science, then it makes sense why nutrition matters. And vitamins and coenzymes, phytonutrients, phytochemicals, bioflavonoids, all those things that you can get that are plant-based antioxidant supplements, good diets and so forth, they help the cell to be healthy and to heal faster, but you still have to get rid of the bacteria. So that's just a quick deep into a quick dive into a deep hole. I call them rabbit holes because they can go in all different directions, but that's kind of the oral systemic science. And that's why this inflammatory burden, when it gets in the mouth and in the body, then sets the stage and predisposes us for all these other systemic disorders, such as vascular disease and neurodegeneration, and so on and so forth. My point is that the principles are still the same. The biochemistry is still the same. Go ahead, Bill.
I just wanted to lap onto that with one comment related to the glutathione. I was sitting in a dental XP lecture 2 years ago, and up on the screen, one of the more advanced lecturers said to the fact that the main reason we lose implants is because of oxidative stress. And he was talking about exactly what we were studying as we were learning about redox biochemistry. And the fact that implants are just like teeth in many ways, they have to have a healthy oral environment. Periodontal tissues around teeth, the peri-implant tissues around implants need the same nutritional support. And without that cleanliness and without that lack of bacteria, you're going to set up the inflammatory response. And it was dramatic. And I think that's one reason that we see a lot of our implant patients do better, keep their implants safer longer, because of the supplementation just gives the body the ability to create glutathione, which goes to work whenever there's a need.
Hey, Grant, could you segue out that? And this is a universal principle. You know, the oral systemic, we could actually reverse that and call about the systemic oral. You know, they're indispensably connected, but it's that undergirding biochemistry, if you will, that applies everywhere. Do you want to comment about that? You're on mute.
Well, I'd say, you know, I'd mirror what Bill just said. And, you know, there's some interesting things I did not know there about the oxidative stress cause for failure. A couple of the people that I invited to this call tonight were periodontists, and it'd be for me, it'd be a good way to share a way to increase the success of their implant cases. And we know that somebody that's been in the business almost from day one, she had a implant done with a local periodontist here. And I think she was having to travel, and so was the periodontist. So she went in for an early checkup, post-operative checkup. And the periodontist was amazed at how quickly the implant had recovered. She didn't expect that at that point. And so that's what I'd say is, you know, in the body, like say, if the body has what it needs to do the restoration, the restorative process, then it's going to happen more efficiently. It's really like if you have a vehicle that's full of gas and you get part way across the state, you've got to top that tank off, or you're just not going to make it. The same way with the body, you've got to, you know, we're on a journey of life and a journey of health. And if we get halfway through this course and we're running out of gas, we're running out of molecules, then we start to see the problems show up. So we just need to top that tank off and keep it topped off, so that our body always has the way to respond to the challenges.
Yeah, and that is a consequence of aging, isn't it? As we get older, our mitochondria become less functional. They decrease in their abilities. And I think that might be an important point, because we've talked about oxidative stress here and inflammation, and the way I look at it, those are synonymous, although they're somewhat different in terms of their physiology. But they're very synonymous. They go hand in hand. When there's oxidative stress in the cell, for whatever reason, it's going to kick inflammation off. If you see inflammation, it's because there was oxidative stress in the cell first. In a parallel way, if we say, well, if you see disease, if you're experiencing disease, if you have these problems, it's because of inflammation. And that's because of oxidative stress. So we can kind of work that backwards and say, the root of the problem is to deal with oxidative stress. Well, that comes from the mitochondria. Comes from the mitochondria as well as outside influences that can create it. But when the mitochondria gets less efficient, it becomes older, it starts producing more of those reactive oxygen species, we call them ROS. Then the cell's ability as we age becomes less efficient at signaling for the defensive or responsive mechanisms that will deal with it naturally. And so that's where lifestyle comes in. I think ASEA is a great lifestyle, just like taking vitamins is about lifestyle, and exercise is about lifestyle, and good sleep is about lifestyle. So those lifestyle or biooxidative approaches are about making and helping the mitochondria work more efficiently and giving the cell the tools that it needs to be able to responsively function in a way to deal with whatever happens. So the other thing we could say is that anytime somebody gets better, it's because the signaling improved. Wouldn't you agree with that, Bill?
I like the analogy of the topping off of the gas tank so you could go across the state. It's pretty appropriate these days with the Colonial Pipeline being shut down by hackers. So I kind of had a thought, what is the hacker that gets into the mix that shuts down our pipeline?
That is a great parallel.
The ROS is what's flowing through our pipeline,
Yep.
So we're looking for the answer all the time. What can make our systems go? What can make us more efficient, stay healthier longer? We coined the term healthy longevity a while back, and it really does apply to ASEA to extend life by repairing and replacing cells as they break down. And the more you can repair them, the longer you're going to last. We turn over our cells how often? It depends on which cell of the body. But you turn your skin over about every 28 days, and that's actually the reason they named this Renew 28, because of the turnover of the cells of the skin. And it's pretty dramatic when you see people have an injury that heals faster than you expect. I mean, most people heal the same rate, but then when you get diabetics, they don't heal quite so fast. And as your body deteriorates, you don't heal so fast. And you look older because your skin's just not repairing itself. And we like to try to bring those things into dentistry, share with our patients, the benefits of preventive health. And this is probably one of the primary preventive health agents that we've ever found.
So let's talk about why this is marketed the way it is. This is when I first became aware of this, when our good dear physician friend said, go get some.
Where?
I didn't realize what it was, and it was kind of an awkward moment for me. It was a really difficult bone to swallow for me. Why? Why did they go this way, Bill?
Because of the FDA, because there is a reason that it's for everybody, not for just the few to dispense it with a prescription. The owners of the company found a solution that was for the masses, and they didn't want to limit the ability to treat a single disease. They wanted to make it available as a supplement as opposed to a drug. And once they decided that, then they had to go to the market outside of traditional, pharmaceutical methods.
Hey, Grant, what was your thought when you figured that out? Why does that bother you? Was that an obstacle for you?
The aspect of network marketing. No, I was currently involved with a network marketing company at the time I discovered this. And it was a good product too, but there's nothing that can do what ASEA can do. I think one of the things that a different aspect of looking at why it was network marketing, and that is that when you pick up a bottle of ASEA, and my sister can attest to this because I picked up that bottle and I spun the bottle around looking for the active ingredients, and the only thing I could find was water, sodium, and chloride, and I kept spinning that bottle. Had to be there somewhere, a label, small print, whatever, but that was what the ingredients were the sodium, the water, and the chloride. And so that's one thing. It requires a certain amount of explanation that this is not salt water, but it's made from salt water. It's just very similar to if you were to go down to the grocery store and pick up a box of Betty Crocker's cake mix. You look at the ingredients and it doesn't say cake. It says that on the front of the box, but which is similar to ours. It says redox molecules. But you turn around and it shows what it's made of. There's flour, there's baking powder, there's salt, there's sugar, there's a number of other things you probably can't pronounce. But we don't think of the cake as being those things. We think of cake as being cake. So the ingredients, that's something I think that really is a thing that needs explanation. The other thing too is that somebody might skeptically look at that bottle and say, well, this bottle of salt water, what's that going to do for me? And if you have examples of what had happened to you, like my very first experience was I burned the back of one of my fingers putting a hot dish into the oven, and instead of putting it under cold water, cold and ice, I immediately went and sprayed that area with ASEA one time before we had our lotion. And that recovered, no pain. And I saw a friend of mine 3 days later, and he could not find any spot where that burn was. So that's an experiential thing that you can share with somebody. And so I think the network marketing, it's another term I've heard is relationship marketing. You have a relationship with somebody and you share something with somebody, and you have to be, a lot of times, except for the current time, up close and personal. And so there's a development of trust. There's a certain amount of trust that you need to have with that individual. It really helps if they trust you as a friend, that they will listen to what you have to say and heed your advice. And, everyone deserves to know about this. Not everyone's going to heed the message, but everyone deserves to know about it so they can make a decision. And that comes through people-to-people contact.
Yeah, thanks for your observations on that. This was a difficult pill for me to swallow at the beginning. It just is for me. And I recognize, as kind of echoing what Bill said, is that there's a certain genius in being able to take something like this that is so foundational. This isn't, and in the future, I can tell you just from the research I've done, in the next 10 to 20 years, the pharmaceutical industry is going to tap into this research, and they're diving very deep into very specific redox switches that are with very, with infinitesimally precise mechanisms to be able to switch isolated molecular switches inside the genome. That's where this is going. And over the next 2 decades or longer, the whole concept of redox, just the whole idea of redox itself, is going to start to become very commonly talked about. It'll become a household term. And here's ASEA, which has brought this very, I'm going to call it ground level, ground entry, broad basement. It's even below the DNA level. It's at the epigenetic level. They brought that into the marketplace in a way and that every cell in the body benefits. It doesn't matter what kind of cell it is. That's why we don't speak of diseases, because it doesn't really matter. I'm just making cells healthy. I like to think of that as the inner doctor. I'm waking up the inner doctor so that it can act on its own rather than have to be acted upon by some outside intervention. And so I think that has been a real key thing. With that thought, what do you think, Bill? Is this, how big is this going to be? I mean, not just in oral health, but I mean in broad base.
there's no stopping ASEA and redox biochemistry from becoming a major force in medicine and the pharmaceutical world, but the nutraceutical world is where it is right now. And we are the only company that actually produces anything like it. So it's pretty much unique to us. Can't get it anywhere else. So we have a very unique place right now in the market. It is so important that there's going to be fortunes made in the future as companies decide how they can utilize this concept to turn the genes on pretty much at will. And if they can focus them, it's going to be even better. But right now, we've identified, 16 pathways at least that we can turn on with the use of the redox molecule. And the hormones, the systemic area for inflammation, it just keeps going on and on in different areas we can go into. So a lot of us have experienced personal change in our systems in our body measured by body chemistry. So we know it's real. We just have to figure out, when is the best time to recommend it and what level. One of the things we always know is a little bit helps some people. Some people need a moderate amount, and a few people need a lot to get the result because they're so depleted in their glutathione and their the redox level of their body. Oxidative stress is a killer, and we really do need to modify it if we're going to live longer.
So thanks, Bill. I want to apologize to everybody watching. The chat box has been closed and just now opened up. We had our webinar host a little distracted. We've got a few minutes left. If you have a pressing question that we could address, we'll do that. And while that's happening, I just want to share. I want to share my screen and show a picture of my wife. Can you see that?
Beautiful. Look how she's changed.
Okay, so here in the upper left, this was in April of 2018. And the two pictures on the right were taken about a week or two apart, about 2 weeks after she started taking ASEA. And the one on the bottom, and so that was the middle of November, and the one on the bottom was in the middle of December when we had one of our unusual Friday night date nights. We went out to the movies. It was the first time she'd felt good in a long time. This is 30 years of health issues. And as I made reference earlier, this was this is what changed it for me because of how profound that was for me. If I can figure out how to unshare my screen, we'll get back to the chat. Bill, go ahead and make a comment or two to Grant, and I'm going to try and figure out how to do this.
Anything in this screen?
Yeah, that's a pretty incredible change. And the smile and the sparkle in the eye really shows, the change. We have another picture that we see of an elderly lady. Her name is Rosie, and everybody I think knows Rosie, but there's a picture of her at 85 years old, and she looks like the lady you definitely let cut in front of you at the grocery store. You don't want to mess with her. And then it shows, there's a progression up to 90 years old. And I've shown this picture, this series of pictures to people, and I've asked them, which lady is the oldest in this series of pictures? And of course, they always go down to Rosie, the bulldog. And anyway, then they say, well, how about the youngest? And they always go to the 90-year-old picture. And I said, well, first off, I said, the one on the left is the youngest, and the one on the right is the oldest, and it's all the same woman. And their jaws usually drop when they see that picture. And that's just a testament to, even at that age, 85 years old, people think there's nothing you can do about anything, and all of a sudden you just turn the fountain of youth back on. I say putting the putting the aging gear into reverse.
Well, this has been a real great delight. We've got 2 or 3 minutes left, and our hope tonight was to present some oral health, oral systemic perspective. I know all 3 of us have fielded and received questions from a number of people over the last 2 or 3 years asking about whether redox would work for this or that. And I'm just to make a broad answer to that. One, for example, that I can recall is like, I need a root canal. Can I swish ASEA and not need a root canal? And the answer is no. You still need to go have all the recommended treatment that your dentist is going to recommend, whether it's periodontal therapies or root canals or tooth extractions. There's a lot of very mechanical and biological things going on. But what ASEA can promise to do is that you can improve the cellular health and the cellular foundation so that your experience through all that will be improved. Wouldn't that be a fair characterization, you two?
I would absolutely say that.
In the chat room, somebody's asking how long do you hold it in your mouth before swallowing? A minute is a good recommendation because you're activating the oral fluids, you're deactivating bacteria, you're doing good things. So swish and swallow.
Yeah, and the associated question I often get is, will the metal fillings, in my mouth affect ASEA? And I'm not going to say that there is zero effect, but I'm going to say it doesn't matter. You're getting immediate absorption through the mucosal membranes in the mouth, the tongue, under the tongue, the back of the throat, all the way down the esophagus. So just don't overthink it. Just swish. I tend to take and sip on it, and I'll hold each increment in my mouth and kind of swish it around and squish it between my teeth and then swallow. So any last things, Grant, before we sign off? We've got about a minute, and then we're going to hand this back over to Jim, who's going to invite our Australian friends in, and they're going to take it over for the next hour. Go ahead, Grant, your final comment.
Okay, well, the question comes up, and you've been presented with that too, and everyone in ASEA has, will it help this? Will it fix this? Well, whatever. The best answer I've ever heard to that is, does what you're talking about involve a cell? And the answer is in the question.
Yep. Bill?
Yeah, my last comment is if you've been invited to join and become a member of somebody's team in ASEA, you should just say yes and do it, and then figure it out later. Don't be thinking about it too long. Just go ahead and start, because nothing puts health into your body better than something like this. It's preventive, it's safe, non-toxic, and it will benefit you. And then if you really want to build a business, you should learn how. If you just want to take it as a patient, treat yourself, that's totally okay. I would do it.